Valproic acid or sodium valproate. It is a carboxylic acid derivative. Sodium valproate or valproic acid is a broad spectrum anti-epileptic drug. It is an anti-epileptic drug class carboxylic acid derivative. A broad spectrum anti-epileptic drug. Mechanism of action. Like phenytoin and carbamazepine, valproate delays the recovery of sodium channels from inactivation. That is, it prolongs the inactivated state of sodium channels. It delays the recovery of sodium channel from inactivated state. Like ethosuximide, it blocks T-type calcium current in the thalamic neurons. Like ethosuximide, it blocks the T-type calcium current in thalamic neurons. It blocks the T-type calcium current in thalamic neurons. It increases the activity of GABA in the brain. How? By two ways. It increases the synthesis of GABA by stimulating GAD, that is glutamic acid decarboxylase. It stimulates GAD and causes increased synthesis of GABA. It decreases the degradation of GABA by inhibiting GABA transaminase enzyme. So, valproate delays the recovery of Na plus channels from inactivation. It blocks the T type calcium channels in the thalamic neuron, and it increases the activity of GABA by stimulating GAD, that is glutamic acid decarboxylase, that will increase the synthesis of GABA, and it inhibits GABA transaminase and decreases the degradation of GABA. Pharmacokinetics of valproate. It is rapidly and almost completely absorbed from GI tract, highly bound to plasma protein, 90% bound to plasma protein, metabolized in liver and excreted in urine. Rapidly and slowly absorbed, 90% bound to plasma protein, metabolized in liver and excreted in urine. Adverse effect. The mnemonic for adverse effect is valproate. V for vomiting, A for anorexia, and abdominal discomfort. The common side effects related to GI tract are vomiting, anorexia, and abdominal discomfort. V for vomiting, A for anorexia, and A for abdominal discomfort. CNS side effects include sedation, ataxia, and tremor. So, A for anorexia, ataxia, and abdominal discomfort. Then L for liver. A rare but serious complication is fulminant hepatitis. Okay, this is related to L for liver, hence avoided in children younger than 3 years. Valproate is avoided in children younger than 3 years because it can cause fulminant hepatitis. Monitoring of hepatic function is essential during valproate therapy. Okay, and it causes elevation of liver enzymes. E for elevation of liver enzymes. It causes fulminant hepatitis and elevation of liver enzymes. R. P for pancreatitis. Pancreatitis may occur rarely. Acute pancreatitis may occur rarely. R for rashes, skin rashes. O for orofacial and digital abnormalities. Valproate is teratogenic. T for teratogenicity. It causes orofacial and digital abnormalities, neural tube defects with increased incidence of spina bifida. So it should not be given during pregnancy. Valproate with the T stands for teratogenicity. It causes oropharyngeal and digital abnormalities, neural tube defect, and increase in the incidence of spina bifida, so it is not given in pregnancy. And E for elevation of liver enzymes. So V for vomiting, A for anorexia, alopecia, abdominal discomfort, ataxia. There are four from A. though related to GIT, that is anorexia and abdominal pain. Anorexia and abdominal pain, one related to CNS ataxia, and one is alopecia. It causes alopecia and curling of hair. L for liver, it causes fulminant hepatitis. P for pancreatitis, acute pancreatitis. R for rashes, skin rashes. O for orofacial and digital abnormalities. T for O for orofacial and digital abnormalities. A for alopecia, anorexia, abdominal discomfort, ataxia, and alopecia. T for teratogenic. It causes orofacial and digital abnormalities, neural tube defect with increased incidence of spina bifida. And E for elevation of liver enzymes. Uses sodium valproate is highly effective in absence, myoclonic, partial SPS and CPS, and generalized tonic-clonic seizures. ठीक है, कौन कौन से सीजर्स में यूज़ होता है? एब्सेंस सीजर्स, मायोक्लोनिक, पार्शियल और जनरलाइज्ड टोनिक क्लोनिक सीजर्स. Absence, myoclonic, generalized tonic-clonic seizures, and partial seizures. Other uses of valproate are mania, bipolar disorder, and migraine prophylaxis. Seizures like myoclonic absence, partial, and GTCS. Also used in bipolar disorder, mania, and prophylaxis of migraine.